guys, this is Amy here at Moment of Truth Physical Therapy, and I'm going to talk today a little bit about some of the different things that might cause pain during your pregnancy. So that's a big part of what we do here, is helping women avoid pain during pregnancy and stay active. So obviously we know that we have a pelvis and it's attached to a spine and our legs, and there are 3 layers of muscle on the pelvic floor. And so all of these things, then of course you've got your bladder, the uterus, ovaries, all of your intestines, and your internal organs, all in the abdomen, all right here, all in the same space that baby's going to be growing. So some of the most common things that cause pain are pubic symphysis pain, where there's stress on the pubic bone and where that attaches with the cartilage. A lot of times too, there's stress. People talk about sciatica a lot, back pain, things that stress on either side of this SI joint, and the sciatic nerves come out right through here. Back pain in general, mid and upper back. So as obviously our center of gravity is changing and things are shifting in front of us, then we also have all of that torque on our body, and that can sometimes create mid-back pain. So again, as baby is growing and putting stress on all these different structures, some women will get rib pain, whether that's coming from the mid-back or as baby's growing here, stress on this cartilage area here, get inflamed. You might cough or some different things during pregnancy and flare up the ribs. We also, there's so many, I don't want to bore you guys with an anatomy lesson, but there's tons of tissue and different ligaments that suspend the bladder to the walls, the uterus to the bladder, the uterus around. Some of those ligaments, you might have heard of the broad ligament. That's one of the main ones. And so there can be some deep groin or broad ligament pain that happens. And of course, God knows which position baby's shifting into or where they might be punching or kicking and contributing to pain throughout the body. So we just want to try and make sure there's as minimal torque as possible on the system, minimal torque on the pelvis, and help you avoid pain and stay active throughout pregnancy. So again, I hope that answers some of the different things that might be causing pain during pregnancy and give you some assurance that most of it is very treatable. Maybe seek out a pelvic PT if your symptoms are getting more serious, or even a good prenatal massage can really help out. So let us know if you have any other questions, and thanks so much for listening.